For today's video, we're gonna do infant bath and cord care. So the first thing we need to do is to provide a comfortable environment with good lighting and temperature. Then we need to wash our hands and prepare the necessary materials such as a basin to serve as a bathtub, another basin to capture the water or to where we'll place the water and soap solution, a lukewarm water, a a cold boiled water, cotton balls, diaper, a face cloth, a towel, a bath soap, baby's clothing, and a doll. And you also need a trash bin where we will dispose the used cotton balls. So the first thing we're gonna do is place the towel in a diamond fashion next to the basin. Then, we will now pour water on the basin and check for the temperature. We will check the temperature by using our wrists or elbows. Okay, so the temperature is ideal. Now we're gonna remove the clothing of the baby. So the baby, hard mo ang clothing na. Okay. Now we're gonna wrap the baby snugly. So the first thing we're gonna do is wash the baby's face. So we'll start first with the eyes. So we'll do this by gently holding the baby's head and using cotton balls with a warm water placed on it. So we're holding the baby's head. And we'll start from the inner canthus going to the outer canthus. Okay. So once we're done cleaning the baby's eyes, we'll now go to the face. So we'll start from the middle area of the eyes and mouth going outwards. Then also pay attention to the neck area and the area of the ears. So when we do this, we also need to talk to the baby so the baby can feel the warmth of the nurse. Ganito lang siya. So we need to clean behind the ears and the neck area. Then we'll pat it dry. We will now wash the baby's head. So we'll do this by lifting the baby in a football position with a towel covering them. Then we will, using our thumb and pinky finger, will cover their ears. Then we'll pour water over their head. Then we'll place a hyperallergenic baby soap on their scalp. And we'll rinse it. Now we'll place the baby down and using the corners of the towel, we will pat dry the head gently with a firm circular motion. Ako nang gitay pipi. So in washing the body, we will unwrap the towel and remove the diaper of the baby by raising their ankles and removing the diaper. So we have unwrapped. Now we're going to raise the baby's ankle and remove the diaper. So now we will create a water and soap solution in another container. Then using a washcloth, we will dip it in the water and soap solution. So we'll start from the upper extremities of the babies, so from their neck, going to the arms. Paggabasan mo ka mga DP. Okay, so we've got another washcloth and pour water over it, which we will use for rinsing the hyperallergenic solution in the baby's skin. So we'll do a one long stroke motion. Then we'll pat the baby dry. Now we'll put the baby on the side and do the same. We will use a washcloth for the hyperallergenic soap solution and clean the backside of the baby. So we'll lean the baby on the side, supporting them. Then we'll clean the back area. And using again the washcloth with the clean water, we will rinse the area. And we'll pat the area dry. After this, we will place the baby in a supine position. So baby will place the supine position. Then we'll cover the baby's upper part to keep them warm. Now, using the same washcloth for the soap solution, we will now clean their legs and their toes. And using the cloth for rinsing, we will now rinse the area. Ito kita. Okay. And now we'll pat the area dry. We'll do this gently. And lastly, for washing their body, we will clean their genitals. So for a female patient, such as the baby, we will use cotton balls with a warm water and a soap solution. Then we'll separate their labia and we'll clean this by going from front to the back. And dispose the cotton. Then do it on the other side as well, from the front to the back. we will pat the area dry. Okay. And the other side. So now we will perform cord care. So in this part, we will clean the stump of the umbilical cord using a cotton balls. Ideally, we should use a cotton pledget, but since we don't have, we'll just use a cotton ball. So we'll do this by cleaning the area around this stump, the base of the stump, in a circular motion. Then we also need to remind the mother to keep the area dry until mapagak siya. So, inikita sa mama kato siya ina na, Mami, di na to kanang bason mayo ang kanang pusod sa bata ha. At dapat uga na siya permihan to matanggal siya. Kay if mabasa siya kay na may chance na ma-infected siya. So ato na siya permi ipa-uga. Okay, so once you have got the area dry, we will now put diaper on the baby. And once we have placed the diaper, we will now place clothing on the baby. Okay, hapit to kang baby, kami ng kuha. Okay. So now we will get another cloth where we will wrap the baby snugly. So again, in a diamond position, we will wrap the baby snugly. Then we will give the baby to the mother so they can have more bonding time. So that ends our infant feeding and cord care. So the last thing we need to do is do aftercare on the materials. So we will now return the materials and dispose what needs to be disposed. So we will return their containers and dispose the waters that we have used. And return the cotton balls. We also need to wash the cloth that we have used on the baby. And once I've returned this officially ends our procedure for infant feeding and cord care.